My dear student, this is today's my class about basics of chest imaging. When you go for the radiography, when you go for the imaging modality, there are if you talk about X-ray, talk about radiography, talk about CT, MRI, ultrasound, you must know about basics of the imaging. Then only it's easy to understand when when you go for the any modality of the imaging. So that's what today in this class I'm going to include about what all basics expect you must know. This is very one of the important topic. Definitely there are a lot of in a topics which is a lot of questions which is comes in exam is covered in this chapter. So all of you know that there are different types of body plans are there. If you go with the first, which is sagittal plan, this is the plan where it will divide right and left of the body, right and left of the body. So this plan, which is will vertically, it will pass through from front to back or back to front. That is what it is called a sagittal plan. So mid sagittal plan means it will divide right and left. So that's it called mid sagittal plan. But a sagittal plan means it will divide the right and left not equally, might be in the anywhere. But it will divide the right and the left. That is what sagittal plan. The next plane is coronal plane. This is the coronal plane where it will divide right anterior to posterior. That is two segment. It will divided by this plane. So this plane also is it will pass through the vertical line along the one side of the person or the patient. In this also it is, if it is called mid coronal plane, means it will divide anterior and the posterior. So that's is called a mid coronal plane. Also this in some time we will refer also as axillary plane or mid axillary plane or axillary plane. Certain some radiography, when you talk about it, example, if you talk about the left lateral chest X-ray, when we talk about, we will tell that axillary line should be perpendicular to the cassette or should be perpendicular to the table or vertical bucky. So that means axillary plane or coronal plane is the similar meaning. The next one is the horizontal plane, which is divides the superior and the inferior. It's called horizontal plane. So also this is where horizontal plane is called in many names: transverse plane, axial plane, cross-sectional plane. Usually axial plane or axial section is the commonest word which is used in the CT, MRI during imaging. So this is where it will divide the superior and the inferior portion of the part. The next one or the last one, oblique plane, where oblique plane you can see in this image. This is the oblique plane. So this is the coronal plane, how it will divide anterior and posterior. This is the plane, how it will divide the right and the left. This is the oblique plane, where it will be oblique in the sense it will be, once it's entered, it will enter to the coronal and sagittal plane. So that's what the oblique plane is, can be passed through the part of any angle among the three planes what we explained previously. So that's what is called the oblique plane. Certain time we will take oblique radiography and all, that time oblique plane is one of the important part. But axial, coronal and sagittal is very important, especially sagittal and coronal is very important plane in the radio. When you talk about, when you write about the radiography, this two is very important. So what are the patient expect is required when you talk about basics? Anterior aspect, which is called viewing patient from the front side. The posterior aspect also called dorsal aspect, which is viewing from the patient from the back side. The lateral aspect might be right lateral or left lateral, whichever the side you seeing from the one corner of the body, that is called a lateral aspect. Then medial aspect refers, which is called refers to the side of body part which is close to the midline. Midline means already I told you the sagittal plane or sagittal mid sagittal plane, which is whichever part which is closer to the midline is called a medial aspect. So that is what there are different patient aspect. So next is comes to the positioning terminology. So there are positioning terminology and projection terminology. These are two things is there, so don't get confused always, because whenever it comes to the question in the exams, a lot of time I seen that the students will, if it is asked about positioning terminology, they will write about projection terminology. So these are two different things. So you have to please concentrate on this. Now I'm going to talk about the positioning terminology. First of we'll take erect. The erect is the projection it taken in patient in sitting positioning or standing positioning. So most of the time when erect means, always most of the technologists, most of the person is thinks that patient will be standing. No, we can take with the sittings also. That is called a erect positioning. If it is patient is comfortable, then only we will ask the patient to stand. If it is sometime what will the patient not able to stand, the patient comes with a wheelchair, how can you ask the patient to stand in the near to the bucky and all? It's not possible. So that moment you can take it in a sitting positioning. So that's what in erect positioning, it can be a AP, it can be a PA, it can be a lateral, any view, but totally it will be erect position. If it is standing or sitting means is a erect positioning. So posterior PA view, if you take posterior aspect against to the cassette, if you say that is called AP. If it is anterior part is closer to the cassette means is a PA view, and lateral means right side if it is touching to the cassette means left lateral, left side if it is touching to the cassette means left lateral, right side if it is touching to the cassette means right lateral. So whatever patient if it is standing means it's called a right positioning. So what are the other positioning views? You can see here there are certain images are there. Three images which I kept here. This talks about decubitus, which is patient lying down in any direction. See, now there are three different decubitus views are there. Here first images which is patient is supine, lying down in supine positioning. So dorsal part of the patient is touching. Dorsal means posterior part of the patient is touching to the table. So this is supine or dorsal decubitus we call. If it is prone, patient is in a prone positioning, patient anterior part of the patient is touching to the table, it's called ventral decubitus, means lying face down. The next one, lateral decubitus. This is the lateral decubitus. So where patient lying on any side, that's what previously I told. If it is an erect, we will call erect positioning. In the same time, same thing, we in a decubitus view also we will have the right, this is, you can see this is left side, patient is touching on the table, it means this is left lateral decubitus. If it is right side, it touching means right lateral decubitus. So out of these three, this is the commonest. Every time we will take this radiography frequently. There in certain next classes I will explain about different views, what are the views is taken with the decubitus view. Here also you can that's what positioning terminology. If it is, this is a right lateral erect patient which is standing, right side is touching to the cassette, this is called the right lateral erect. If it is left side touching means the left lateral erect.